or otherwise we start and
Yeah.
they can join whenever they come. Okay. John, what do you suggest?
Yeah, that's fine.
Okay, then we start now.
Yeah, it's okay.
Right? Lakshmanji?
Yeah, I messaged her. If she can, she will join definitely. Otherwise, yeah. Let's continue.
So basically, she confirmed her participation, but I don't
Okay.
know.
Okay.
Anyway.
Oh, she had confirmed. Huh? That's good. I messaged her again. Yeah.
Okay, very good. So, welcome everybody, and thank you for your time and interest. So, we have very brief agenda for today. We start with project updates. Then briefly, second point is regarding CMU updates. Then AOB, mainly three points are listed here for today's discussion. Under AOB, we have brought in few points here: Innovation Fund, Advocacy Fund. If there are any concerns, questions from your side, we'd be happy to take up those. Or you may also include any point that you feel important here to discuss today. So starting with this project updates, as in our invitation itself, we requested all of you to bring with you one image of the project that show at least good progress, maybe in terms of physical facilities, in terms of some software activities or whatever you think is relevant. So we'll go with that project wise. Now we have 3 projects here. Maybe in the meantime, India will also join us. Then on that, we'll discuss few points like WASP progress, challenges, and areas where any technical support is needed. So let's start with this agenda point first. And who is going to volunteer first? Any one of you? So you please can share your screen and then start explaining your photograph. Let's start with that. So who is coming first? Or shall I invite Nepal? Navinji, are you okay?
Yeah, okay, sir. It's fine with me.
Please then.
Okay, allow me to share the screen. So is it visible to everyone?
Yes.
Okay. Hello and namaste, everyone. This is Navin Rana. I'll be presenting today's COP on HCF on behalf of TDS Nepal. As per the first topic in the progress update, I'll be showing highlights on one image. Basically, I've shown 2 images, but the first one is the highlight one. As you in the picture, you can see it's a picture of a training that's infection prevention and control and health care waste management training. As you can see, these are health personnel who are attending the training, and the health post support staff is preparing a chlorine solution. And another picture is the health coordinator of the same municipality who is facilitating the training. Okay, so in Bardia, the infection prevention and control and healthcare waste management is one of the major issues in Bardia that we have been knowing. Thus this has been included in as one of the priority tasks listed out in the waste improvement plan by majority of the HCF. So the municipality, they had sought for technical support to TDS Gerua. So as per that, in collaboration with municipality, we organized a similar training, which was attended by the municipality health coordinators. And after attending this training, the municipality decided to organize similar training to staffs from all the remaining HCFs located within the municipality. And in some of the trainings, the health coordinator, he himself facilitated, delivered some of the topics. And further to that, we supported them with basic essential cleaning materials with the catchment of the training, catchment of the municipality. It was conducted in 4 events. The first 2 events were conducted under the facilitation of the project team, whereas the remaining 2 were facilitated by the municipality themselves. So I think this picture sums it all about the training. This demonstrates the ownership of the local government as well as the replication for future sustainability of such approaches. I think we can conclude from this. Allow me to get into another topic, which is the WASFIT progress. Here in Bardia, in December, we have completed the prepared the WASH improvement plan using the WASFIT tool in all the 8 targeted HCFs. They have been meeting regularly once a month. The WASFIT team regularly sits and they discuss on the current status and the earlier months review. So in that, the field team, they try to attend these meetings as an observer, and these are documented in the meeting minutes of the HCF as well. Recently, the WASFIT team, they submitted a formal proposal to the municipality so as to include the actions that were listed down in the WIP for budget allocation. In the picture, you can see there's a meeting being held in the office of local government, where the WASFIT team as of OMC, they're having a joint meeting so as to advocate about the importance of WASH in HCF, and they are requesting to allow for the fund allocation. And at the same time, yeah.
I think we just need to ask the other participants to mute their microphones.
Yeah, may I request all the other participants to mute themselves, please.
Thank you. Thanks, Naveen. Please continue.
Yeah, I'd like to continue. At the same time, the HCFs, they're also in the process of reviewing the WIP that were developed 6 months more than 6 months earlier, and they're planning to conduct a phase assessment. Last week only, on Friday, we conducted a review of in one of the HCFs called Khairapur, which is nearby in Guleria, and they conducted the second assessment, and it was reviewed. So after that, they will prepare another similar like plan, and they'll carry forward whatever the findings were. So this is all about, I think, about the WASFIT progress, and about and the third topic is the other challenges in the WASFIT process. Basically, there's an absence of formal system for WASH reporting to municipality. So because of this, there is no clear information that is being delivered to the municipality about the status of the WASH facilities in the HCF, like there's a HMS system inbuilt, where they report every vaccination or medicine related information that is being delivered to the municipality. So there is no formal formal system. So I think this is one of the major challenges all over Nepal, not only in Bardia. So I think because with the help of this, it would help to bring attention of the municipality and support in resource allocation as well. We have been raising through different forums. We have been raising this issue with the local government, and I think we could explore the possibility for digital tool for reporting. I think. And another challenge is there's a little understanding, there's little understanding on the importance of WASH in HCFs in some local representatives. I don't say in all, but in some. So because of this, there might be challenges in allocating the budget. So we've been dealing with the issue since the beginning, since the sensitization process and the advocacy meetings. So I think these are the two main challenges I'd like to say here. Thank you very much, sir.
Thank you very much, Naveen-ji, for your brief and clear presentation. Shall we quickly go for some discussion on this? If there are some points for clarification or some questions, maybe Naveen-ji will take and respond to those. If someone has some sort of points for clarification, please.
I would have some, but I can wait if there are others.
Okay.
Shall I go ahead?
Please.
Maybe I would like to ask a question,
Good.
if that's okay.
Please go, Lakshman. Yes.
Now, just Naveen, my question is, I think you carried out this training because there's an indicator in WASPIT whether IPC training has been implemented or not. I think for that, we can say that IPC training has been indicated. You can give 3 pluses there. And what about the further things after following what is being done? What is the impact of training? Because this delivering training may not be sufficient. There may be need of some policy, or how that will be measured, or how do you say about that? How well, but ultimately what we want is there is an enhanced cleaning in the healthcare facility related to WASPIT indicators. How that will be ensured? That will be ensured through other indicators, or because just I have always been wondering about that aspect. Can you comment something on around this, if may not be exactly what I said?
Yeah, as a part of project activity, we had conducted the training. So after this training, we expect that the environment cleaning part in the HCF is well taken care of. So I think that's all.
This is an area we need to work definitely.
Yeah.
We need to ensure that because these has to come within our WASPIT indicators, that cleaning is done. There's a progressing, I think. Thank you for that. Thank you.
Thank you, Naveen-ji. And very relevant and important question was raised by Lakshman-ji, and then Naveen-ji is quite believed that from the training onward, I mean, they have started environmental cleaning and it will be continued. That's what they believe, the team. But of course, I mean, we have to put the sort of regular again efforts to that maybe. John, you want to?
Thank you. Yes. Thank you very much, Naveen. It's a really great overview, very brief, but with a lot of good information. I think we can discuss for a long time, but I just have a few quick questions. One is, so who carried out the actual training of the municipal actors? I missed that part, sorry.
In the beginning, it was the training was conducted by a resource person that we sought for.
Okay.
And he conducted the training.
According to is it the Ministry of Health Nepal curriculum for IPC?
Yeah, exactly.
Okay,
As per the national curriculum.
Okay. And then those trainees from the municipality, they in turn did the training to the staff.
Yeah, exactly. In the second, first they received from the support of the project, and in the second phase, they carried out the training themselves with the support from project, and the trained they themselves they facilitate the training, as you can see in the picture.
Okay, thank you. And who did they train among the staff at the healthcare facility?
Basically, they trained the staffs of the remaining HCFs of the same municipality. So not only the staffs, but there were some municipal staffs as well.
Okay, and in the healthcare facility itself, you have different staff members. So you have nurses, doctors, cleaners. Who received that training?
Basically, the training is focused to the support staffs.
Okay.
Main focus is on them, and a part of that, the other health staffs they also participate in the trainings.
Okay, great. That's good to know. So the cleaners are what you call the main support staff, were the main focus. So that was really at their level. I think that's really important, that the training was delivered at the level of those who are really on the front line of taking care of the cleaning and assuring these things, but that it's everyone's business, and so everyone else was involved. Okay. Good. Lakshman mentioned wash fit indicators around cleaning and around following up, and definitely this is where the wash fit tool is much more interesting than Facet. Facet is really just our monitoring tool to go in and look at some basic things that we measure for our own outcomes, but it's the wash fit assessment with more developed indicators that can help. So I think that distinction is very important. We do know that there's going to be a new version of WashFit coming out with more enhanced indicators for cleaning, and maybe we'll talk about that a little bit later, but this could be something to look out for in Nepal.
Okay.
On WashFit, on the process that Terrorism is using, just a couple last questions. I see that you've documented the meeting minutes, and I know from what Prakash had communicated before that there are monthly meetings. I was just wondering, how does the project document the WashFit assessment in the scoring in that process, and also the improvement plan? Is that also documented in some way?
Yeah, definitely. In the beginning, after the assessment, after the assessment is complete, they prepare a report, and they prepare the WIP plan. It is clearly documented, and each copy is being delivered to the HCF, respective HCFs, and to the concerned local government. So that is how it is documented. Okay.
Is the plan, the improvement plan, is that part of the report, or is it a separate document?
Yeah, definitely, it is part of the report, and the plans, they are displayed in the HCFs themselves. Okay,
that's really interesting. And the last question on that is, when you're doing the documentation, is it an electronic file? Is it in English or Nepali? Is it something which is, or is it in hard copy?
It is hard copy report, and it is written in Nepali language.
Excellent, very good. Yeah. And you mentioned before that a digital version of WashFit could be interesting, and that's something we can also talk about in the future. Thank you very much.
Thank you.
Back to you, Ramesh.
Thank you, Naveenji. Thank you so much for your nice presentation. So, are there any other concerns for Naveenji, or shall we move forward? If not, then may I invite, first of all, before going to second presentation, Runaji is also here with us. So welcome, Runaji.
Thank you, Ramesh.
So will you start?
Yeah.
Will you start?
Yeah.
So, please.
Yeah, I'll do. Just let me know that if you can see the presentation, because I just got a new device and it is creating some strange problems today in our internal meetings. Also, I was facing. Just let me know if you're able to see it. Just a second.
Please share. Yes.
Are you able to see it?
Exactly. Yes. Yes.
Okay. Okay. So, good afternoon, good morning, everyone. As you are aware that in India, we have been able to do some activities, but not like Nepal, Myanmar. So I'll share whatever is the update present as on July and what is planned next month, and some of the pictures of the facilities that we have renovated, constructed, and handed over to the government. Uh, so can you see my third slide?
Yes.
Or is it the same
Yes.
slide that you are seeing? Okay.
No, third slide is there. Yeah.
Okay. So we have completed construction renovation work for the wash improvement in 5 healthcare facilities. And again, the renovation work has been completed, and then it has been handed over to the inauguration process to 4 facilities. The other one, we will be doing it in the coming week. Water testing labs has been finalized because we had discussed this several times that water testing is important. And from India, we had mentioned that after handing over these facilities, or because during that time handover, we were not able to do because we were not getting an authentic water testing lab. We searched for many testing labs. So now we have just handed over. We will complete it is planned in this month, and we will complete the water testing things. By testing in the quality in the healthcare facilities. It is a government lab which we have identified, and we got the details profile of that lab, and they have done many projects in the government system with other organizations with a reliable team, and they would be able to do that. We have forwarded them what are the requirements of SWSC water quality testing parameters, and they will do that for us. One healthcare facility renovation work is ongoing, which we will complete it very soon. And a joint monitoring visit from the TDH team was made to the 2 facilities, which were completed and we handed over, which was including Kira, the new country director, Oporajita, Kallol, and the health team here, because neither Ameshji nor Lakshman is able to come. So we made a visit to the facilities, and yes, the constructions were okay and seen from a different perspective. We got good positive feedback from the team, and also we interacted with the government officials. They are very happy with our support. However, as I was mentioning, for the PWD features inside the facilities, since the space is restricted, we were not able to do much on the PWD features. However, we have decided that we will bring in an agency, CBM, who work on disability, people with different abilities, and we will take them to our health facilities and ask them to assess like what are the possibilities we can do, even if there is space restrictions are there and we might not have the fund to do it, but we will just show them. And we can have a report, an assessment report. We have decided that we will have an assessment report and figure out that these were the things that would have been good to have. But having space constraints and lot of approvals that needs to come from the government and all, and also fund availability, we would not be able to do it. And that could be some observations and recommendation report that we will develop. I will show the images here. So this is a hand washing station in one of the facilities, the filter, the toilet, as you can see, and the segregation room with the color coding as per the recommendations here in the India government, and the incinerator here in one of the rural hospital, Ashunti Rural Hospital. The second one we go is like here again, the inauguration event happening. And over, if you see the 5th picture here in the second line, in Bengali, we have written how to use the facilities, that we should not be wasting water. We should be watering the facility, and then after use also watering them. We should, while coming out, we should see if all the taps are to prevent wasting water, and the toilet is clean, and hand washing is important. So in Bengali, we have put a icy kind of a thing with messages so that the people in the outdoor who come can, while using it, they can understand the importance of not only using but maintaining it. So planned activities, again, 2 HCFs will be handed over to the authorities. That is, I'm talking about August. Water quality testing will be completed, and handover of the improved facilities constructed in the names we have mentioned, Goshava, Kuchitala, PHC, Canning to authorities. Training of the cleaners, we have never done it. So we will conduct, this will be the first time we will do training of cleaners on cleaning procedures and IPC, and orientation of the washfit committee members on a new PHC, which is Jharkhali, where we will start the construction work. But before that, we will do the orientation, basic orientation of the washfit committee members. And as you know, we have submitted the reports like in August, so it was already there in the PPT. And drafting designs in one of the facility, Gutiari Shori, we are drafting the designs and budget estimate. It will be sent to Lakshman for his review. And once it goes the go ahead from him, it will be finalized and the construction work will be initiated there. So this is the update. Challenges are that, as Lakshman is aware, and I think we have discussed in the meeting also, in the common meeting, regional meeting, that India government follows a cleanliness guideline for washing healthcare facilities, which is the Kayakalp guidelines, and all the facilities are following that. At least in West Bengal, in the facilities where we are working, it's a mandate and they are following it. However, that thing is still in their mind, that an annual assessment is done. And many of the indicators which is in the washfit is missing in the Kayakalp guidelines, which we had shared with Lakshman, and Lakshman has reviewed that presentation. So what we are doing is that we have taken a strategy of entering the point, saying that is Kayakalp is good, appreciating that, and then saying that washfit is a bigger thing. It covers more indicators, and whatever facilities we are constructing, washfit assessment process will help in better usage and maintenance of the infrastructure. And also the availability of the washfit committee members is a challenge. We have done the basic orientations in the facilities where we have handed over, and we will be starting the training soon, but they are little kind of with COVID and many things. But we have, the discussions have happened, and we will start the training of them in this month. We have one subdivisional hospital under our list, which is the Canning Subdivision Hospital. It's a lengthy process because initially we did not know, and but now we are figuring out that in a subdivisional hospital, which is a big hospital at the subdivision level in the district, there are a lot of processes, kind of a lot of endorsements has to come within the system itself, the hospital authorities, before we can kind of also initiate any discussions. So that thing we are doing it from our end, talking to the subdivisional health authorities and all those things, and making them understand. So this will be finalized in another week, I think, but this is a lengthy process that we are facing in a bigger hospital. With the primary health centers and with the rural hospitals, this challenge was not there. Thank you from my end. If you have any questions and any suggestions, and that is welcome. Thank you so much.
Thank you. Thank you, Runaji. Thank you very much for your excellent presentation and explanations, where you are and what you plan for tomorrow. Now the floor is open for questions, points for clarifications from anyone, please.
While this is going on, if Runa, if you could show the slide number 4, so we can all again get to look at the infrastructure and some of the images while we're listening to the Q&A.
John, can you be a bit louder? I don't know, it's a problem in my system. I can't follow it properly, what you are saying. Sorry for the inconvenience.
Well, yeah.
Yeah, this better. Yeah.
Okay. I was just saying, while the Q&A is going on and the observations of the different colleagues, if you could show the slide number 4, I think, where the images of the work you've done, that we can look at that, have a little more time to look at it while we're listening to the discussion. That'd be really, really useful for me, at least.
Yeah, I'm on slide number 4, yes.
Thank you. Thank you. Sorry, go ahead, Ramesh.
Yeah. Any questions?
Can I have a question?
Yes, please, please.
Lorenzi, I'd like to ask you one question. I saw that in the HCF, you're planning to install water testing labs. Could you elaborate the process, the support, how the support from where it is being installed, or and basically the processes? Could you elaborate on that?
The water testing lab, you're meaning to say?
Yeah.
So we know that, like, we agree and we have to do the water quality testing in the facilities, in these public facilities. So what we are doing for a long time, we were looking for a agency who would be able to do the water testing, because in the government facilities we have figured out that the filters are installed. You can see the filter there also. It was a kind of government filter, but it was not functioning. We made it functional, and it's a reverse osmosis process filter. So but the testing of the thing, water quality, doesn't happen. So now we were actually looking for an authentic lab. We talked to many agencies, and they were also some agencies were not doing the water quality testing as per the standards of SWSC, the recommended standards, because we have to follow that also. But now through a long process, we have found out which is a government lab, and they have worked credible work with many agencies, and we discussed with the team there who would be working on, and we are having a terms of reference signed with them that these are the 9 healthcare facilities where you have to test these parameters, the recommended parameters of water quality in these facilities. This is the process which we followed for testing the water quality.
Okay. Thank you.
Okay.
Good. So, next.
I wonder if Neong or Tigist or others have questions for Runa, or observations, comments.
We don't have, but I have one observation, because we found India lagging behind in terms of mobilizing the stakeholders with WASFIT tool. But later, when I worked with them, I realized that they already have a system which is similar to WASFIT. So there's a need to work alongside. There's a need to merge together. So we cannot, it was not possible there to just go with WASFIT because they already had a system. So, but the team have compared the two systems and found some additional better indicators in WASFIT. So they would be, I think their strategy would be to pursue them to include those indicators. It could be within their Kayakalpa framework. I think that should be fine if it is, as long as, and then they can, with the model of WASFIT, they can try to see what additional dimensions can be added. I think that they would adopt that type of approach. Just not in India, in Nepal, there was no system, so WASFIT was fitting in well. So in India, they had that. We realized that later. So hopefully they will try to make what WASFIT and then Kalpa merged together. It may be Kalpa, but additional indicators they may try to include from WASFIT, and what other better methodologies that are there in WASFIT, those systems. Yeah, I think that is one realization.
Yeah, so I agree with you, Lakshman, because as you have reviewed the indicators, and like it's much broader and covers whatever is there in WASFIT. But as I was mentioning, Kayakalp is the thing that the government is following for quite some time. Since 2014, they are following. I mean, until by the time it materialized and it was at the ground level, it was 2016. For quite some years, 5-6 years now, they are following that. So that is there, and it is much easier for them because they are doing an annual assessment. So the assessment process we will do as per the standards of. We are mobilizing them to, motivating them to do it. Like it should be quarterly as per the WASFIT process, and that is why we are entering through that process, because we also had in India had a recent discussion with the WaterAid, WaterAid India, and they did some kind of this. They are saying they did it, though they did not share any document with us or documented challenges what they faced with the government in implementing WASFIT. But they have verbally told us that they have tried implementing WASFIT in some state, Maharashtra, which state they were mentioning, and said that there is lack of ownership comes in when you try to push them the wash fit, because kayakalp is something they are following. And then they will dump the tool saying that it is so big and all those things. But we are trying to make the government explain that because we are doing construction, because in the kayakalp guidelines, the water maintenance part, the sanitation, those indicators, important indicators are missing. Okay, some of the hygiene indicators there, but not all is there. So that's why the first point we did the comparative analysis for our understanding what is missing and what is common. We will enter and we will make sure at least in, if not 9 facilities, some of the facilities it is functioning and wash fit, they are able to reasonably understand and accepting it along with the kayakalp as a part of kayakalp. So that is what our intention from the India team is.
Sounds good. Thank you.
Thank you, Runa and Lakshman.
Thank you.
This kayakalp process, is it like wash fit? It's a cycle of assessment, improvement plan, action, review, this kind of thing?
It's an assessment plan, John. It is annually assessed, and it is assessed by, there is a state committee that comes, and committees change every year. So there's a state committee formed, and along with district health officials and other district department officials coming. So they come to the facility, they have discussions, they do physical observation and review. And additionally, apart from that, there is peer review. So from one facility, they go to the other facility, and there is exchange, cross exchange and peer review of the facilities. And when they see that 70%, 70 to 75% of that thing is standard is maintained in that facility, then they are awarded a particular amount of money to use for maintenance of that facility in that year. If it crosses more than 80%, then they have an increased amount of money. So it is incentivized from the government. Okay, and this is an annual process that is followed, and a strict guideline is there, government guideline is there, known as the kayakalp guideline. So it's a process, and a lot of indicators are there, and how it should be done. Some physical observation, it should be discussion, it should be filling up a format and scoring, and scores are given. What should be the score that should be given? And at the end, whatever marks come and whatever scores comes, the facilities are incentivized. So this is the process of kayakalp.
Wonderful. Definitely, that sounds like the tool to work through and to enhance. If I understood correctly, what you and Lakshman are saying, that could be some work that you do to try and demonstrate more in-depth indicators. We do know that there is a new version of WashFit coming late this year, early next year, with more spot-on indicators, according to a review that's going on, and that the consortium is a part of. So maybe that can also give you some more points to follow through on that dialogue. I just have 2 more quick questions. I don't want to take too much time. I think it's fantastic that you're, just one observation, that you're using CBM, the Swiss organization, to look at what could be done despite lack of resources, lack of space for the people living with disabilities. I think that's a really good way to go about that report. My one last question is the TOR you're going to sign with the government lab. So then the project is the project going to pay for the services that will be done during the life of the project? Or is this something that you're setting up a connection with these facilities to provide a longer term service for water quality testing?
No, John, for these facilities, we will be paying them, because so long we don't have any system. So we will be paying them, and then let us see if we can negotiate with them and something can come up that, but for this,
Sure.
It's not only the thing of the lab, it should be the ownership of the facility authorities also to be interested to collaborate and do that water testing jointly. So we are still figuring out, because ownership is also a challenge I think every country is facing, and we just started working in the facilities. But as of now, we will pay them to the agency, and we will keep on the discussion, continuing the discussion with them to see if kind of at least once in 6 months or they can do some assessment, even if the project is not there. So let's see, because as you know that we are presenting a no-cost extension. So next year also we will have some months to work in those facilities. So by that time we will have some time if we are able to negotiate something with them, and there is some positive outcome of that. Let's see.
Thank you, Runa.
Yeah.
This
Thank you.
this presentation and also that of Nabin. If you could upload them to your project pages on the intranet, I think it'd be great. And
Yeah,
also,
sure,
if there's
sure,
this,
sure.
the comparative analysis that was done between Kayak Help and WashFit, if that's something which is documented, it'd also be great to see that. If it's
Yes,
not
it's
documented,
ready. We can upload,
okay.
John, no problem.
Thank you so much. Thank you.
Thank you. Yeah.
Back to you, Ramesh, unless others
Thank-
have comments or questions for.
Someone else, if any questions. If not, then I have a small point for clarification, Runaji.
Yes, please. Yes.
This design of incinerator, whether it is somehow a standard design of your health authorities in West Bengal, or your
Yes, it's a
project has,
standard design here, Rameshji.
uh,
Yes, because in many of the facilities where we renovated, the picture for the renovation, it was already existing, and we have made it steps, so that because also to prevent from waterlogging and other things, and so that the people can rise and put, and there is a lot of space because we have made it step, and this is the thing system in the West Bengal we are seeing. So that's why we are promoting the same system instead of cutting that and taking it away, and doing something different.
okay. Thank you very much.
Yeah.
Okay. If not, then we move to another project. Maybe Tigist, may I request you to present your project active. Tigist.
Okay, I will present. Thank you.
Yeah, please.
Ramesh. Can you see my presentation? The file?
Yes, visible. Please.
Yes, we see your photo very well.
Please, yeah. I don't know. I have another one, but I don't see it on the screen. Just wait a moment. Good morning, good afternoon all. What we did during the past 6 months in the project, this project has started in January. And what we did at the beginning is this project has two components. We are going to construct a big water scheme, which will serve around 8,000 people. And this water supply system will also supply to healthcare facilities that we are planning to implement this wash fitting approach. So from the water supply system, the two healthcare facilities will get connection to their facilities. That is underway currently. We are building service reservoirs, and we are also laying pipes. In terms of the wash fitting, what we did at the beginning is we did a baseline survey of the wash situations of the two healthcare facility using the online systems. That baseline outcome is analyzed, and now we have the document. With this wash fit approach, what we did at the beginning is we tried to get a buy-in from the local government. So we organized a series of meetings with especially the water supply authorities and also the healthcare, the health offices. So we organized meetings with them. We described the wash fit and the process it involves and its benefits in improving the health outcomes, including the reduction of or prevention of infections. After some time, we have agreed, and they willingly accepted the approach, and now they are willing to implement and lead these wash fit processes now. After that, what we did is we reviewed the Warada Health Plan and what they have in terms of improving the health service of the two target healthcare facilities. And what the review shows that they have a plan in improving the infrastructure of the health facilities. That means the buildings they are planning to maintain the infrastructure, and they have a plan to construct incinerators, latrines, placenta pits, and they also have a plan to build pharmacy in the health center. The two health facilities that we are planning to implement this project, one is a health center and the other one is a health post. So we reviewed this one, and after that, what we did is we established the wash fit team. The wash fit team includes people from head of the healthcare facility, like the head of the healthcare facilities themselves, experts from these healthcare facilities, like laboratory technicians, maternity, IP, cleaners, community representatives. We also include people from the water and sanitation committees like WashCo. We included people from Kabale administrators also. Kabale administrators, Kabale means the lowest structure in the government organization, in the government structure, the lowest unit. We have also included health extension workers. These are people that work in Kabales and they work closely with the community. So we included also people from health extension workers, and we have also included one woman who gave birth either in the health center or health post. So we formed this wash fit team. After establishing this wash fit team, we did the wash situation analysis in the healthcare facilities. So what we have done is we organized a workshop and we introduced the wash fit to these wash fit members. It's step-by-step implementation and the procedures. We have described all these things to them. So after that, the wash fit team, they carried out the wash situation assessment in the healthcare facilities using the wash fit indicators that were selected by them. And they also has done this wash situation assessment using the sanitation inspection tool. They identified the hazards, the gaps of the healthcare facilities. After we have done all this, we completed this before some 2 months, something like that, but we stuck there. We have a challenge. There is a staff turnover in the partner organization that we are working with, like the implementing organization is another one. It's called Irsham. So they had this staff turnover, so we couldn't do the analysis. So we have discussed for some 10 days, we have discussed with them. So we are planning to organize a meeting. That means HEX staff and the implementing partner staff. We are going to meet in the field. We are going to create awareness, like we are going to train the new staff about this wash fitting, and we are planning also to talk to the government office staff, the health and water supply staff, and we are planning to do this analysis very soon. This is where we are at in terms of implementing this approach. I think that's all. Ramesh, back to you. Or
Okay.
any,
Okay, thank you. Thank you, Tigis. Thank you very much. So now floor is open. If any queries, questions, or let's say suggestions to her project, please.
I would invite the project teams to share their reflections and yeah, what comes to mind when you listen to where Tigist is at with the process, and do you have any recommendations based on your experience?
Yes.
We have some 3 projects with experience. Also Neong having experience, although it's difficult now to continue having started it up. Anything coming to mind, Neong?
Okay, thanks, John. Let me share my screen.
Sorry, Neong, this was not yet for your presentation. This was about Tigist's presentation. If you have anything to feedback or any reflections on what she shared. We're still doing the Q&A with Tigist and
No, it's nice to see the learning from India, Nepal, and from Digits about their work and their respective country. Yeah, it's really nice.
Okay, great. Thanks, Neong. I would have just a couple points and questions, Tigist. First of all, the others may not know this, but you have been in touch, or you're starting to be in touch with WHO because you have published a story on your work in initiating WashFit for the first time in Ethiopia. And WHO is interested in that. So it's good to see that you're in contact with them now in the field to share information and also ideas and experiences. So that's a good news. The question I might have is this analysis of the assessment. Who will do the analysis, and who will make the plan? How is that step? I know you're having this challenge of the team in the turnovers. You need to train the new local partner team. Who's involved in that training? Are there other stakeholders in that, and who will be doing the analysis, please?
yeah, the analysis is going to be done by the WashFit itself. But to organize, a meeting between them, we need to have, the staff from that implementing partner, and the facilitation has to be done, to organize a meeting, something like that. Otherwise, it's the WashFit team that will be doing the analysis. John.
Okay, great, thank you. I was also wondering if, maybe it's too early to say this, but when the analysis comes in, because your project was already planning on doing water and you started installing the water systems, I'm just curious if this is an opportunity to look at the other services that your project might not yet have had specific plans for, and to allocate resources to other services based on the analysis of the assessment and also the WashFit plan that comes out of it.
Yeah, as you said, it's a little bit early to respond to that one. Let's see the analysis, let's see the outcome. To improvements that we don't have a plan in the project. What we are planning is to have a discussion with government offices, since they have yearly they have a plan, a budget, and they allocate budget. So We are planning to discuss to them and advocate for such kinds of improvement with them. We are planning to have their own resources for the improvements or the gaps that will come after the analysis. That's what we are planning.
Thank you, Tigis. That's very clear. That's WashFit in its purest form, where if accessing local governance or Ministry of Health localized budgets can support. So as you know, we've seen with other project teams, I think with Terrorism in Nepal and others, they were able to leverage the WashFit process to attract attention and resources to the healthcare facilities. And even Terrorism Mali, they succeeded in getting a local governance structure to fund the toilets that were lacking without any project funds. So that was a bit unexpected for them. So some things can happen out of this. Of course, we have to stay realistic, but it is possible. So good luck with that. And we're definitely willing and interested to keep following and supporting as much as we can.
Thank you, John.
Thanks, John. Anybody else do have some queries? If not, then I'll say big thanks to Tigist, and I would like to now request to Neon to please proceed with your presentation. Neon, please.
Okay, thanks.
And Tigis, please also upload your photo and any caption you might have for that photo onto the internet. Very nice one.
Can you see my screen? The presentation?
Yes.
Okay, good.
It is.
Okay. Good afternoon, everyone. I'm now from the Myanmar delegation, British Myanmar delegation, working as a project manager for WASH Nutrition and Health Project in Laibaya and Ship the Township of Yangon region. This is a highlight on the photo. I like to present about the healthcare waste management, one of our achievements and WASH picked implementation, working in the 7 healthcare facility in Laibaya. This is just one of the achievements. Healthcare waste management in HCF. Our project provides the waste disposal bin to the 7 healthcare facility in township. It includes 2 sets of 3-color waste bin with better 20 liter and 1 set of 3-color waste bin with better and wheel 240 liter, the big one for each HCF. And waste bin are labeled so that the patient and caregiver easily understand what sort of waste to dispose where. Because for the healthcare staff, it's easy to understand where to dispose waste by looking at the color. But for the general people, it needs a label on the waste bin. So we request and we ask the healthcare staff to label properly on the waste bin so that the general community understand where to dispose waste. 20-liter waste bin, the small one, are normally placed in outpatient consultation area and 1 set in the labor room. The big one is just outside of the facility to store the daily or weekly waste from that 20-liter small waste bin from the consultation and from consultation areas. But the situation is that before the CoP, we're not sure what's going on there after the military coup and the CDM. As all of you aware that in Myanmar, after the coup, most of the healthcare providers are involved in the CDM. And then the HCF were not fully functioning yet. So we need to make sure and check once everything is over, I mean, the return to the normal situation. And also the CDM step also join again to the HCF. In regards to the waste field progress, due to the current situation in Myanmar, and waste field process adapted cannot be properly operated since the 1st of February. And due to the widespread civil disobedience movement of the Hacker workers, again, most of the Hacker workers were still from the CDF and HCF are not functioning yet. Some of the waste field team members, especially the water authority, were also away from the township. They're hiding because the SSC arrests them, especially the one who involved in the general strike, and also work under the civilian government. So some of the waste field team members are not in the township areas and also in their respective area. They're hiding. We cannot contact them as well. In addition, this situation also wasn't by the COVID that week. Lockdown, movement, gather registration, and also workplace closed till 22 August announced by the SEC. But it might also extend to maybe, I don't know, maybe end of the August or maybe first week of September, depending on the situation of COVID that week in Myanmar. And the challenge of the same, like I mentioned above, movement and gather restriction due to the COVID-19 third wave, and consequent widespread insecurity and severe disobedient movement of the civil servants and Hacker workers as a result of military coup. Those situations severely disrupted the operation of HCF and also disrupt our project operation as well, because if we like to continue, so if we like to implement, we need to inform and get approval from the SAC official. The problem with X, we are following the non-engagement policy. So we, at the moment, we cannot do anything. Just working remotely, like I said earlier before, we're now just working on the mobile cash transfer for the vulnerable bracket movement term under 2 years, just working through the phone. And the project area is stay under the martial law, so we cannot work or we cannot go around for the implementation of the project activity in the community and also in the HCF as well. That's because of the military coup and its following consequences. And for the technical support, I would say no at the moment, because most of our projects are on hold because of the current situation in Myanmar. That is from my end. Sorry.
Thank you. Thank you, Neong.
To share about that experience or situation in Myanmar. Yeah.
No, this is really very difficult situation that you are going through, and we are very sorry for that. And what we all can do is just we hope for the better. So with this, I would like to open the floor for questions, query, because this project is very, very far ahead in terms of WASPIT progress. So still, I mean, Neong and his team has lots of experience, so we can benefit from that. So anyone, please, if you have any question or some sort of clarifications, suggestions from him, please.
Neong, thanks. I had a question. If you can go back to slide number 2. After you installed the waste bins, I think maybe there wasn't time to go and follow up and see how they're being used. Is that correct?
Yes, because before the coup, they used the waste bin properly, because we also provide kind of the dry monitoring visit together with the township department.
Okay. And two questions. How does it work with the plastic bags? Are they familiar with using this? Do they have supplies of plastic bags that they can procure themselves in normal times, not now, of course? And also, what was the disposal like? What was happening on the disposal side? Or
Yes,
what was planned?
yeah, they use the plastic bag. They have to buy it themselves with the funding of the HCF. For the waste disposal site, as of we have installed and constructed the incinerator at the primary healthcare center. So for the infectious waste and the sharp waste, they send those waste to the primary healthcare center for the disposal, for the disposal, and also for the incineration of those infectious and sharp waste there.
Okay. And who's doing the transport of those wastes?
The how can I say, the water servants, the cleaning staff.
Okay.
Yeah.
Okay. So it was a completely independent service. Okay. Excellent. So
Yes,
of course, everything before the coup, but that was how it was set up. Thank you for that. Yeah. Waste bins with plastic plastic liners and plastic bags. This isn't available, of course, in all the countries, and some countries need to use a different system. I think Ute, when we had our community of practice meeting on waste management, she was saying that some facilities will rotate the bins without the liners, but they'll just replace the bins, and then they clean the bins really well and then replace them. But good to know there's plastic bags in Myanmar when things are in normal situation.
Yeah.
Thank you so much, Naon. That's all from my side. I don't know if other colleagues have some words or anything.
No, nothing from my side. Thank you, Nang, and all the best.
So with this, is there any further point or points? If not, then thank you very much all for your presentation, for your sharing. Now we go to the point 2.
So I will stop my presentation. Thank you all for understanding me and also our project here in Myanmar. We are really.
Thank you, Neon. So now we move to the second agenda point. So it's basically CM updates. And John, would you please take up this?
Sure.
Yeah.
Sure, I will. How much time do we have, Ramesh?
Yeah, we have still some time, so we can continue. No problem.
Okay, great. So just like to share. The first update is on I had sent an email around a few months ago about delivery room indicators. I hope that that's familiar. The idea is we used in the Facet tool the indicators for delivery rooms. We actually were testing them. These were put out as draft indicators recommended by WHO in addition to the general service area indicators. I'm just going to make a pause here in a parentheses that Facet is the tool we use for just our own monitoring purposes. It's something that we can involve the local authorities with. We can use the information to share with them. We can involve them in the survey, but it is not the wash fit assessment. It is something which is far less substantial. The wash fit assessment is probably the best tool to use. It goes in depth with working with the wash fit teams. So this is Facet results that are shown here in our one dashboard, and this is what we put into the annual report. And I just wanted to highlight some of the differences, what we could see going on between the general service areas and the delivery rooms. So this is across all 56 healthcare facilities in the general service areas. of each of the 7 consortium projects on wash and healthcare facilities. And so we see that 1/3 already had a basic water service at the baseline. A little bit over 1/3 had a limited sanitation service, but only 2 or 4% had. I'm sorry, my math is. I'm stating this. These are numbers of facilities. Sorry, the basic water service was approximately 60% of the healthcare facilities already at baseline had a basic water service. Only 4% had a basic sanitation service. 25% a basic hand hygiene service. So that's a hand washing station with water and soap available. 13% had a basic waste management service, and almost a quarter, 1 out of 4, had a basic environmental cleaning service. So those indicators we won't go into now, but what I thought was interesting to compare was that between the general service areas and the delivery rooms, it's more or less the same for the water service. So they're all normally sharing the same water service. There may be a separate building, but it was found generally to be the same. We saw there was a slight improvement. So of the 56 healthcare facilities, 53 have delivery rooms. And so that's why there's a smaller number here. We found that there was a slight improvement in service, a better service maybe in the delivery rooms for sanitation than in the general service areas. Just wanted to check. I'm sorry, I forgot to ask. Are you able to see my screen?
Yeah.
Okay, good.
We see.
Okay. For hand hygiene, it's worse, actually. Only 15% had a basic hand hygiene service in the delivery rooms compared to 25%. So a lot of work to be done both in general service areas and in delivery rooms, but it was interesting to see the difference. For waste management, it was more or less the same, a little bit better, maybe better sorting or triage in sorting of waste in the delivery rooms. Environmental cleaning was much worse in, sorry for that noise, the wind, in the delivery rooms as compared. So we can see that there's a certain aspect going on in the delivery rooms, as some of the member organizations are really focused on maternal and child health and do a lot of work on prenatal services and birthing services. This is important for us, but it's also important because this is a major place where infection can take place. So with that, I'd sent an email around asking if anyone would be interested in giving a review of the indicators that we used. And all of you responded positively. All the member organizations responded positively. Thank you very much. Since then, I've been very silent on it. But today, I'll just give a very brief overview of when I discussed with the World Health Organization. I was asking them what would they like to see in terms of feedback from us on delivery room indicators. And they asked if we could, by the 15th or maybe by the 3rd week of October, if we could get feedback on the indicators themselves. Are there any indicators that are very difficult to assess? Is there anything missing in terms of an indicator that they should include, adding other indicators or even editing or adapting them? And secondly, a more broad question they have is, how can we get these questions integrated into wider quality improvement work? So if, for example, as Runa and Lakshman were talking about the process in India, which is a separate evaluation process, do they have specific indicators for delivery rooms? Are they needed, for example? Some of these indicators that WHO has proposed, would that be useful in integrating this into their process? Just an example. Not sure what's going on in Ethiopia with the way that the government is monitoring. In Nepal, maybe this could also be part of the wash fit process, but and Myanmar we could see, but so that's the other thing that WHO is keen on understanding. Is there a way to integrate these into the broader health services, the monitoring services for health within your countries? And then finally, are we asking the right questions that are going to raise awareness on WASH and that causes people to see WASH as a fundamental component of quality of care? And of course, if there's any other feedback. So these are the main points. I will put these into a survey, maybe just a one-page survey and I'll send them around to each of you and ask you to complete this by, yeah, if we could say by the beginning of October. You know, let's take a good month and a half and go into it. If you want to share it before, that's also fine. But I know that this is also a reporting period, so I'd like to, you know, let's keep a good amount of time to get these things done. Why this is important, it gives the consortium exposure to, and also its word to say and advocacy at a higher level with WHO. And it also gives us time as a consortium to reflect on these indicators and to see how well they're working. So along with this survey, I would, these few questions that I'll be asking you for your response, I'll also be sharing the indicators just so you have a handy reference to, you don't have to go back into Facet and see what the questions were. So that's the first point on the CMU update. Any comments, questions on this? Was I audible?
Yes,
I
yes,
have-
yes. Yes, you are audible.
We have already done an assessment in these delivery rooms, and are we going to also make an assessment with different indicators or with the same indicators? I don't get it, John.
Thank you, Tigist. This is a very good question. Sorry, I wasn't clear. You don't need to do an assessment. Based on the assessment that you did and your experience of using these indicators, what do you think about them? Are they useful? Is there anything which is difficult? Anything which is missing? The aspects that weren't there? So basically, it's a way for us to give feedback to WHO that developed the indicators. So no need for assessment, just maybe to reflect and to look at the indicators again, maybe look at it with a more critical eye. Does that answer your question?
Yes, and can I have also a discussion with the healthcare facility people so that we get an idea or a feedback from them also, or is it only as the program team that will be doing this thing?
Absolutely. Spot on question and remark, Tigis, thank you. I would definitely recommend, if you have the bandwidth and the access to people who are also involved in using these indicators, health authorities or healthcare facility personnel or anyone, please, yeah, please make use of that opportunity. We'd love to have that feedback as well. And since you said that, I will make a part in the brief survey form that I'll send. So when I say survey, I don't mean facet survey or indicator survey. I just mean this questionnaire. Let's call it a questionnaire. I'll make a questionnaire to say who provided input on this. Is it just a team or is it other people? You can list the people that did it and who they are.
Okay, thank you, John.
Sure, thank you for those questions. Anything else? Are we all still willing to go through with this? Since we don't have cameras on, I can't see if heads are nodding yes or no, or if someone wrote up, some put something in the chat maybe.
There is
Yes, thank you, Runa.
Yes, we'll do that.
Okay, thanks, Nabi. Great. Shall we go to the next point, Ramesh?
Yes, please.
I think the next point was about the wash fit revision process, and it's actually, I don't have much to say on it because WHO is yet to share the material for us to use. When we spoke with them last time, they were preparing to send it by the sort of middle of the summer. Now it looks like it'll be toward the end of the summer, perhaps in the next 2 weeks. So I feel they're going to send some material. They'll send a version that we can look at of the wash fit, the revised version, and then they will ask for input. They may have a certain survey that they have with that. So I'll be sharing that with you as soon as I get it, and I think they would like to get input in the next couple months. So those of you that have just started using WashFit, this is a great opportunity because it's fresh in your minds to see not only the improvements, maybe they're going to add additional domains, they're going to add more in-depth indicators, but it's also an opportunity to refresh on what is WashFit. And those that have been using WashFit for a long time, well, you may have some very quick and immediate feedback that could be useful. So any and all feedback is useful. And again, you'll be hearing from me shortly as soon as I hear from WHO. There is, however, another assessment, and I'm sorry to bring this on. WHO is really keen on understanding how WashFit is being used to date. So if we say WashFit 1 and WashFit 2, I'm not sure what they're calling the revised version of WashFit. Maybe they're going to call it WashFit 2.0. Those who are using WashFit initial version, so 1.0, they want to know where you were using it and what was your experience of it. So actually here they have sent a questionnaire. And sorry, just a second. They have a questionnaire which is actually online. And it's called a WashFit Implementation Survey. This isn't something that you have to do. It's not a requirement. It does take about 30 minutes to complete, but WHO and UNICEF, they're collecting information about WashFit implementation to understand where it's being used, how the tool is being used, and to better understand the outcomes from the work that's being done with it. So each project, for example, could answer this if they would like, and you could do it within your own project team, or you can involve others in this questionnaire as you like. So there's a survey. There's also a paper version of this tool, and I'll be sharing this with all of you. I think I'll put it on the intranet or in an email. I'll see what's best with Ramesh. So it's very easy to fill out online, but if you don't have a good internet connection, you prefer to do it offline, you can download the questionnaire. So two things with WashFit, I guess. One is they want to know what is your opinion and where are you using the previous version of WashFit? They would like to create a map on that. And the second aspect is eventually when they give the new revised WashFit 2.0 version to get your input on that before they finalize the publication. So another great opportunity for consortium and consortium members to contribute to the WashFit development. Any questions on this, what I've just said?
No question.
Okay. If no questions, I think the third point is a bit of a piece of news from the TDH Nepal team on some collaboration that they've been doing, again with WHO, on a healthcare waste management study. Lakshman or Nabin, would you like to just give a brief update on this?
Yeah, we actually carried out that study. We looked into how waste characterization can be done, and then when we shared, actually we had shared this idea during the training that we had. That consortium facilitated, and then the WHO resource person, she welcomed the idea and she just confirmed that there's a need in the sector. So this is a good initiative. So that was an encouragement. So our team after that took it very seriously, and then they carried out. And we're happy that with this small exercise, we're happy to get what we were looking for. And then we just wrote a paper and we showed them, and they are interested. Now they are now considering if this can be a part of their global healthcare facility waste report that they are going to produce. So we have also prepared a case out of it and shared with them, and they are reviewing it. If they consider, then this will feature in their global report. I think that will be a good thing for TDH and for consortium. So it all went through John's initiative also, particularly in connecting and getting we got to know that there's a need in the sector of such a work. So that was very good contribution from John. That's all for now.
Thanks, Lakshman. And it's really nice to see how that study's come along, and that Lakshman, you're also participating in the global task team on putting this report together. So that's good, great exposure for the consortium, but also more importantly, getting the field experience of consortium members into these kinds of global reports is great. So we recently also were connecting WHO officials in Ethiopia with the Caritas team and Tigist. As I mentioned earlier, I'm pretty sure that in Nepal, the TDH team is well in contact with WHO. If in other countries you need contact with WHO or UNICEF, you think it's interesting to start these discussions, don't hesitate. We can do our best to support that. That's all the updates from CMU. Back to you, Ramesh.
Thank you. Thank you, John, and thanks, Lakshmanji, for your brief explanation about the recent study that you carried out in the HCFs. So now the last point that we are going to enter into is the AOB. Actually, we thought maybe if there are any questions from your side in terms of mainly the Innovation Fund or Global Advocacy Fund, then we can take up those concerns or let's say query. So, or otherwise, if you have any point to add under this AOB, please, you are welcome also for that. So now let's open the floor for these topics. If you have any question or any query regarding Global Innovation Fund or Global Advocacy Fund, please, you can put that.
Just maybe I can update. Actually, I had some time because our team members were out of station. Kira was not there, Prakash was on maternity leave, but I had some time, and so I worked on two concepts. One is related to IPC, and second is related to this waste characterization study. So actually, I thought of this IPC for India initially, because I saw the opportunity to work on this kayakalpa thing. And then, but later when I started writing it down, so it need to have a base on WASFIT. So then I changed, it may not be suitable to India right now, because it had to be related to WASFIT. So, and then later I realized that I am present in Nepal and Rameshji also is present in Nepal. We may not be able to go to India also. So then that came out to, it seems that will be suitable to Nepal. So they are reviewing, they will be reviewing now. So there are two proposals on innovation fund concept I've shared with my team. I think Kira and Prakashji will review, and then hopefully what we'll decide, we may come up with, we may share both, or at least one will share definitely. But we see that, yeah, my presence here and Rameshji's presence here, and it is the same healthcare facility, then it will save a lot of time also when you go to Bardia, so we can look into all the projects together, and all will be related to the same healthcare facility, and all will be related to WASFIT process also. Just I shared this internal message. Let's see how it falls and how it will come to you, if it comes.
Okay, good. Anything, John, from your side on this?
No, that's really great news. This is really what our community of practice is about. It's to take initiatives, build experience, reflect, and yeah, just try to grow the overall knowledge corpus that we have on what best practices for Washington healthcare facilities. So really looking forward to reviewing this, as well as the comparative analysis of Kalikalpa and WashFit. That's also something I'm looking forward to seeing. Thank you, Lakshman.
Okay, any question? Or John, you may also share the progress regarding GAF Nepal.
Well, the news for the Global Advocacy Fund is that we did have one proposal submitted, a full proposal that was submitted by Tourism Nepal, and that's been reviewed by the the Global Advocacy Fund Working Group, and it was approved and recommended for approval by the steering board. So the consortium steering board has approved it, and now it's just going to SDC for a final approval, but that should be relatively quick. So yeah, congratulations to TDH and Nepal for getting the first of the global funds fund. But maybe if in a couple words, Nabin or Lakshman, if you'd just like to say a few words about it.
Nabinji, are you aware of that? I think, yeah, Nabinji was not much involved in that, maybe in the exercise. Yeah, I think we have also prepared all the responses, and they are very good, positive, and your responses gave us opportunity to think further and add some dimensions. These are all written. Only the thing was that Prakash was on leave, and it's a matter of just meeting together, and our internal work is almost ready. We'll be in a position we can share. Just we have to give finishing final touch only. And we are very looking forward to that. And it's an opportunity we can work together with Rameshji. And we have another consultant also. That's a good thing, I think.
Yeah. So John Oldfield was also involved in that review and follow-up. And I think he'll be scheduling a meeting with Rameshji in the future with the team. I was wondering, just in a couple lines, Lakshman, what is the project, and what is the, what's the outcome you're hoping to have? Just to share with everyone.
Oh, okay. That is related to operation maintenance, because we had already been thinking about sustainability, and these things came during our review of, because I was involved in capitalization of Soloka project, SAPA project. So at that period, this need of an operation maintenance emerged to be very pertinent. And then we realized that it needs to be, we need to work from the policy level itself. It should be grounded with a sound policy, and there has to be institutional setups, mechanisms supporting the policy. There has to be, so it tries to address those aspects also. And it talks about realistically costing, that life cycle costing aspects are also there, unless we are able to do the analysis, know the cost of, so it will look into that also. I think these are the major features of the project.
Thanks, Lakshman. So who's the target and who's the messenger?
Target, messenger. Yeah, actually, this is a learning process. There's a realization, operation maintenance, it is need of the sector that is well known. It's a topic to advocate for, but this is where trying to, only advocacy is not working here, but there's a need of a way on how we can work on this. So the idea here is that we work together with the municipality on developing a model. So there is some innovative element also in it. We do realistically sit with the real workers, with the user-centric approaches there. And then because the messengers are also part of the process here, because we learn together, and then it's all embedded together. So ultimately, during the process, we learn together, and we get we learn. That's how it's about design like. So we learn together, and and then we come together, and ultimately, when you share it, then it may go to other actors also. And how we work in, how the process we adopted could also be an example. It could be an example also of advocacy of a process that can be adopted.
Great. So as soon as that's approved, we'll be uploading the project documents onto the internet, and everyone can take a look at this interesting project. Thank you, Lakshman.
Yeah, actually, just to add to that, we had John Oldfield and myself, we had a meeting 2-3 days before regarding this this proposal, and we were a little bit going through the working group's suggestion points also, and we have fixed now meeting with the team on 20th. I'll be sharing the Zoom link soon. So 20th in the evening, Nepal time 6 p.m. it starts. So we'll be discussing maybe for way forward, how to take it forward, basically, in detail in that meeting. Okay.
Yes, yes, thank you. You see.
Anything else in terms of this innovation fund or advocacy fund, or yeah, please.
Yes. Here in Ethiopia, in terms of this global advocacy fund, we have started, HEX has started to discuss with a discussion with Caritas, Switzerland. We would like to develop proposal together. We are still working on the idea. But there is another one that I would like to mention. Is it possible to submit a second proposal? HEX has been working, fluoride is a big problem here in Ethiopia. It affects around 14 million people here in Ethiopia. And HEX has been doing projects in fluoride treatment and removal. But the problem doesn't have proper attention from the government, and we would like also to advocate for more attention to fluoride removal. So we would like also to send or submit a second proposal. Is there any possibility to do that, like submitting two proposals?
There's no limitation on number of proposals you can submit to GIST. So it's really great to hear that HEX is also, we know that HEX is a very advocacy-minded organization. So yeah, please submit the other proposal. You might want to discuss it a bit with Ramesh first. It might be helpful before you go ahead and do the whole process. We do know that there's some preference which is given for the signature approaches, so washing healthcare facilities and schools. So just make sure that the fluoride aspect is also touching on, how it would be important for the schools and the healthcare facilities. Just as a tip. And yeah, I don't see, the advocacy fund is open on a rolling basis, and the working group will review applications as they come in. So if there are early risers like HEX in Ethiopia and you'd like to, submit more than one application, you can. I don't know how if the funds will be allocated within a certain amount of time. I can't say it's first come, first serve, but yeah, it's a good idea to get your proposals in. With the Innovation Fund, we do have a set date, which is due date for the first round of proposals, the 15th of September. If the Innovation Working Group finds that all of the proposals are good for funding, then we accord those funds. If there's any funds left over, we might open another round. So this is a bit the distinction between the Advocacy Fund and the Innovation Fund.
Thank you, Joe.
Sure.
Good. Maybe the next point that we listed under AOB was evidence building. So John, can you just little bit explain on that also, where we are and what are we thinking at CMU?
Sure. So we do have resources to build evidence, and this is going to be allocated for the signature approaches and the Washington institutions that we do. We already have some evidence data building activities in terms of just our normal reporting processes. So this is something which exists. Projects are also expected to do final evaluations, midterm reviews. There are, in normal times, visits of the regional advisors and reports that the regional advisors do. So this is, on one hand, already documentation and evidence that we can gather, but there's also another aspect of doing a bit of qualitative research on how the experience of the project is, what kind of level of outcome or impact these projects could be having, but mainly what is the value that it's adding. So if we want to push forth Washington healthcare facilities in the WashFit process or the Blue Schools approach, what's the added value for that the authorities and the local partners and the the parents or the community members, the students, patients, what are they saying about this? So these kinds of initiatives we want to articulate in terms of what are the key evidence building questions that we want to allocate our resources toward. And so then according to those key questions, we can draw on some already information and documentation that we're using with our normal reporting collection, but also some third-party studies or reviews or support. It's not yet defined how this resource allocation for evidence building will be used. We have taken a step and launched a call for consultants, and we've shortlisted 2 consultants, finalists, to help us develop an evidence building strategy. And then once that strategy is in place, hopefully by the end of the year, we'll start going into the evidence building activities in 2022. This could include post-implementation monitoring for those projects which are ending soon, and that would still have access to their healthcare facilities or schools. But it could include also focused research with maybe academic institutions, local and international, on key questions that we feel are relevant in terms of gaps in understanding about the effect or the usefulness and the value of the signature approaches, and even the global community of practice, what gaps in knowledge they may have and how we could contribute to that. So the consultancy should begin sometime in September, and you'll be hearing more about this in the coming quarter.
Thank you, John, for clear message. Do we have any questions still on these 3 topics?
I have 2 brief points to make.
Okay, please.
On other business. One is I just put a message in the chat window. We usually alternate these community of practice meetings, as you know, between a general meeting like this with updates and exchange of ideas and inputs. And then the other meeting would be a more focused technical theme. So we've done advocacy, but we also did waste management. So the next one for healthcare facilities should be a focused thematic discussion. And I'm wondering if there's anything that is on your minds that we could look at putting together a session on that, some kind of a thematic within Washington healthcare facilities. So if you have some ideas, please put them in the chat window, or feel free to unmute and voice it. Or you can send us an email to Ramesh and myself. I'll just pause a minute in case someone would like to unmute and give a quick idea for us. Going once, going twice. Okay, don't hesitate to make use of the chat window or to write an email. The second bit of news is a good news. It's about actually Tigist. It's about your colleagues at HEX in Bangladesh, who will be presenting on behalf of World Water Week, of the consortium at World Water Week, in a session on Washington healthcare facilities for focusing on environmental considerations and energy. So the nexus of energy, environment, climate change, adaptation, and Washington healthcare facilities. And this is a session which is convened at World Water Week on the 27th of August. It's a bit late in the day for, I think it'll be early morning, actually, very early hours of the morning for the Asia time zone. But Shahid Kamal from HEX is going to be sharing a short video. There's also a possibility that our colleagues from Terezam in Asia will also share something on the subject. But we had a very short amount of time to get an input to World Health Organization on who would be eligible to share. So that's just a good news that HEX is contributing on behalf of the consortium, potentially also Terezam. And we'll be, once we know more about the session and we have a final date and list of presentations, we'll be sending that around via the internet.
You said, John, is early morning time?
Yeah, I think it's around 4 or 5 p.m. I have to check that. 1 second. Please go ahead.
Yeah, no.
And John, maybe Monday I'll share the video. because I prepared the video so that it is useful anyway to us also, because that will help our process also. So Monday I may share it. Huh? Doesn't
Excellent,
matter.
excellent.
Yeah, so I've made like a common. I'll be making like a common video to all. It works both the purposes.
Okay. I've
Yeah.
indicated to WHO and Lindsay Denny that a second video might be coming, and if they can fit it in, please fit it in.
I'll do it on Monday, because I was working today actually because of this. I have another meeting. It's not possible, but Monday just I'll share it.
Okay, great.
Okay, then.
So Ramesh, just to answer your question, the event is to be on the 27th at 5 p.m. They didn't say the time zone. That doesn't help us out. Well, I'll have to come back to you on that.
Oh, no, it's okay. It's okay. It's anyway in the late afternoon, you mean, or in the evening?
Anyway, I think it's 5 p.m. It's going to be quite late night for Asia zone.
We see then. Yes.
Yep.
Okay then. Okay. Thank you. Thank you very much, everybody. Do we have still something, final words to bring in? Or otherwise we can now say goodbye and conclude the meeting. So maybe finally we can say goodbye, open our video also.
Thank you. Yes.
Yeah.
Hi.
Thank you.
Hello. Yes, few more. We are
Nice
all
to see
together
everyone.
8.
Nice to see everyone.
Three more, please. Just for,
Ramesh ji is kind of a few
okay,
more,
just
few
for
more.
2 seconds. Just 3 more. Yes.
Wait. Let me get the view, the gallery view, and I'll take a screenshot. Runa,
Yes,
can
yes.
you?
Who else? Yeah, Runa. Yeah.
Runa, can you?
Then
1
Gopal.
second.
Gopalji. Yeah, Gopalji there. Yang.
Okay,
Yang is
1
there.
second. 3, 2, 1.
Done?
Yes, thank you.
Okay then. Namaste.
Thank you.
Bye.
Bye.
Bye, everyone. Namaste.
Bye.
See you again. Thank you very much.